Hi guys, welcome to the Hidden World of Dentistry. My name is Kevin. I'm a dentist in Chicago, and I'm about to show you a root canal that I did a couple months ago here. All right, let's jump in. All right, so this tooth is number 19. What we're trying to do here is just reveal the pulp horn of that tooth, and when I do so, I can put a little bit of anesthetic right into the pulp chamber. That almost guarantees that the patient would be numb throughout the procedure. We know that it's the pressure buildup when we put anesthetic into the pulp chamber that causes the anesthetic. So that's why I only want to do a pinpoint exposure, just big enough for my anesthetic needle to go in. Because when I squeeze some anesthetic in there, you can feel the pressure buildup, and that pressure buildup is what causes the intrapulpal anesthetic to work. All right, now we're just exploring and discovering the canals. When it's easy to find, I go in with a orifice opener right away, just to flare it out, open it up. If there are harder to find canals, then I would use an endo explorer to kind of find where the orifice is. Awesome. So once we found all the orifices, we just want to go ahead and widen it. Make sure it's easy access for our hand file. As always, we always want to rinse with our sodium hypochlorite. Perfect. What we're doing right now, we're trying to measure the length of the canals with the hand file. I'm trying to get to length first and then sticking the apex locator and measuring it. Perfect. Always clean between your steps. And now we can go ahead and use our rotary. Start with the white file, the 15, but my rotary is actually 17 file for the white. And then you go on to the yellow file, which is the 20. I use 0.04 taper. I like to keep the coronal dentin intact, if you will. Less of a flare with the 0.04 tapers. All right, there's size 25 with that red. Perfect. You notice that I do sometimes like to keep a lot of solution in the chamber as I'm instrumenting. I feel that helps with the lubrication and also the cleaning of the canal. And usually I'll end with a size 30 file in the blue, unless the distal canal of this tooth is very wide, then I would go to a green like I'm doing right now. But the narrower canals, I usually don't widen it up to a 35, which was the green one. We're taking a final measurement just to reconfirm our lengths here. Widen the orifice again. We're fitting the cones in. And we're doing a final rinse, once with EDTA, once with NaOCl, and to dry. Beautiful. Beautiful. And then I use this little syringe to place the syringe into the chambers and into the canals as far down as possible. I'm trying to get the walls of the canal really well coated with the sealer. This distal canal seems to be pretty wide, so we're going to use 2 gutta percha cones. Place it in, sear it off. Beautiful. Perfect. And then we make sure it's nice and tight in there. Nice, clean and well packed. Perfect. All right, obturating the final 2 canals. One, two, boom. Nice. Nice heat sear again. Perfect. I always like to make sure it's nice and clean in the chamber. I feel that if someone were going to restore this tooth after you, you would want them to know that you did your best to do a nice and clean job. Not only that, if you have a lot of sealer around the chamber, your bond, your core buildup is not gonna adhere as well. So it's always good to tidy up after yourself. There you go. Perfect. Yep, you can see that's nice and tidy in there. We're gonna go in a little bit more and make it a little bit more tidy. Perfect. In goes the cotton. We'll take an x-ray, make sure everything looks good, and then coming back for the second part of the procedure. Typically when we take the x-ray mid-procedure, after the root canal, I'll be going to do another hygiene check or an exam or see a quick consult in that time. Right, you see the chamber is nice and clean. That's how we can guarantee that our bond will stay and will stick to all the walls of the chamber. All right, core buildup time. Nice. There's a lot of core material going in there. That's a little too much for now. Perfect. And then we go straight to the crown prep. So when you do the crown prep right after the root canal like this, make sure to take your blue bite registration, your impression matrix, your temporary matrix before you do the root canal, because if you forget, then you won't have anything to make the temporary out of. But because we do the crown prep right after the root canal, we can build up the core just slightly less than what it would be out of occlusion, because we're gonna prep it down anyways. So there's definitely some efficiencies here. So as with always, I always start with the occlusal reduction. I want to do the bulk of the reduction first. That just makes the rest of my prep easier because there's less to reduce. And when I do the depth grooves from the occlusal to make sure I have enough occlusal reduction, it's easier when there's the whole tooth there. As you can see, I prepped the crown under the rubber dam. I like to do that because it keeps the tongue, the cheek, everything out of the way. What we do need to note though is that you see how my assistant is pulling down the rubber dam occasionally, just so I can reach the margin on the buckle there. margin on the buccal is, I would say, the more important margin. Even though it's a posterior tooth, if we make the margin of our crown closer to the line of the gingiva, it makes it look a little bit better. Perfect. Getting set up for the lingual prep, which sometimes is more difficult. All right. And then I'm using a very fine gold finishing burr just to smooth out everything as much as possible. And then a football to polish everything, and back to the gold to make sure everything is nice and smooth. And then, you saw right there, I was adapting the adjacent tooth, just so my lab has some very nice contacts to work with. Perfect. And then we're all set. And then we'll end here. We don't want to put this part of the video on because I don't want people seeing too much of the patient's mouth or anything that can identify the patient. All right, perfect.